Imagine a hospital room in the future. A friendly face greets you. But this is not a human face. It belongs to a robot. This robot is your nurse. It moves smoothly on wheels. It monitors your vital signs. It even dispenses medication. This is the potential future of healthcare with robotic nurses. For centuries, human nurses have been the backbone of healthcare. They provide comfort, care, and expertise. But what if technology could lend a hand? Could robots share the burden and improve patient care? This is the question we face as robotics advance at an unprecedented rate. The idea of robotic nurses might seem like science fiction, but it's closer to reality than we think. In fact, robots are already assisting in hospitals worldwide. They are changing the way healthcare is delivered. Could this be the future of nursing, even in a country like the Philippines? Robotic nurses are not mere fantasies of the future. They are sophisticated machines. They are designed to assist human medical professionals. These robots come in different shapes and sizes. They are equipped with advanced sensors and software. This allows them to interact with the environment and perform a variety of tasks. Take, for example, Pepper. This humanoid robot, developed in Japan, is designed for social interaction. Pepper can recognize faces and emotions. It can engage in basic conversation. In healthcare settings, Pepper acts as a companion to patients. It can also assist with tasks like reminding patients to take medication. Another example is Riba, a bear-shaped robot also from Japan. Riba is designed for heavy lifting. It can gently lift patients from beds and wheelchairs. This is especially helpful for elderly patients or those with mobility issues. Riba reduces the physical strain on human nurses. This allows them to focus on other aspects of patient care. Then there's Moxie, developed by Diligent Robotics in the United States. Moxie is a sleek robot that navigates hospital hallways. It helps with tasks like delivering lab samples and medications. This frees up human nurses to spend more time with patients. Moxie can even learn the layout of a hospital and navigate autonomously. The Philippines, with its growing population and increasing healthcare needs, is also exploring the potential of robotic nurses. While still in its early stages, robotic technology is slowly finding its place in Philippine hospitals. During the COVID-19 pandemic, some hospitals in the Philippines deployed robots to help minimize contact between healthcare workers and patients. These robots were used for tasks like delivering medication and food, taking patients' temperatures, and even disinfecting rooms. While specific examples of hospitals and their robotic initiatives in the Philippines are limited at this time, the interest and potential are undeniable. As technology advances and becomes more affordable, we can expect to see more robots assisting human healthcare workers in hospitals across the country. Robotic nurses offer several advantages. They excel in efficiency. Robots can work for long hours without breaks. They can perform repetitive tasks with precision. This can significantly improve the efficiency of hospitals and reduce wait times for patients. Another key benefit is error reduction. Robots follow programmed instructions meticulously. This minimizes the risk of human error, especially in tasks that require a high degree of accuracy, like medication dispensing. In healthcare, even a small error can have serious consequences. Robots, with their precision and attention to detail, can help create a safer environment for patients. Robotic nurses also offer physical support. They can lift and move patients, reducing the risk of injury for both patients and healthcare workers. This is particularly beneficial in an aging population, where patients may have mobility issues. Finally, robots can play a crucial role in infection control. They can be easily disinfected and can even be used to disinfect patient rooms. This is especially important in hospitals where the risk of infection is always a concern. The human element, challenges in robot healthcare. Despite the many advantages, the implementation of robotic nurses also presents challenges. One of the biggest concerns is the high cost. Robots require significant investment. This includes the initial purchase, maintenance, and software updates. Another challenge is the lack of human touch. While robots can perform tasks efficiently, they cannot replicate the empathy and compassion of human nurses. Patients often need emotional support, which robots are not equipped to provide. There are also concerns about technical failures. Like any machine, robots can malfunction. This can be disruptive and even dangerous in a healthcare setting. Ensuring the reliability and safety of robotic systems is crucial. Finally, the introduction of robots into the workforce raises concerns about job displacement. Some fear that robots will eventually replace human nurses, leading to job losses. However, others argue that robots are meant to assist, not replace human workers. Can robots replace human nurses? A partnership, not a replacement. The question of whether robots will replace human nurses is complex. While robots excel in certain areas, they lack the critical thinking, empathy, and adaptability of humans. Human nurses are trained to handle complex medical situations, make judgment calls, and provide emotional support to patients. These are qualities that are difficult, if not impossible, to replicate in machines. Instead of replacing human nurses, robots are better suited to assist them. By taking over repetitive, physically demanding, or high-precision tasks, robots can free up human nurses to focus on tasks that require human interaction, critical thinking, and emotional intelligence. This partnership between human and robotic nurses can lead to better patient care. Human nurses can focus on the human element of care, building relationships with patients, providing emotional support, and making critical decisions. Robots, on the other hand, can ensure efficiency, precision, and safety in tasks that don't require a human touch. The future of healthcare, a fusion of technology and compassion. The future of healthcare in the Philippines, much like the rest of the world, will likely involve a fusion of technology and human compassion. Robotic nurses are not here to replace human nurses. They are here to augment their capabilities. This collaboration can lead to a more efficient, safer, and patient-centered healthcare system. Imagine a future where robots handle tasks like taking vital signs, delivering medication, and assisting with patient mobility. This would free up human nurses to spend more time with their patients. They can focus on providing personalized care, emotional support, and education. This future isn't far-fetched. As technology advances and robots become more sophisticated, they will play an increasingly important role in healthcare. The key is to ensure that the integration of robots is done thoughtfully and ethically, with a focus on improving patient care and supporting healthcare workers. Training the next generation robotics in Philippine universities. To prepare for this future, the Philippines needs to invest in robotics education and research. Universities can play a key role by developing specialized programs in healthcare robotics. These programs can equip future generations with the skills needed to design, implement, and maintain robotic systems in healthcare settings. The government can support these initiatives by providing funding for research and development. They can also create policies that encourage the responsible and ethical adoption of robotic technology in healthcare. The future of healthcare in the Philippines is brimming with possibilities. By embracing technology, investing in education, and fostering collaboration between human and robotic healthcare providers, the Philippines can create a healthcare system that is both technologically advanced and deeply compassionate.